Can you guys hear me just fine? Is this going to be good? All right. I will try to be louder. You all can hear? Okay.
You got to turn on the mic.
Oh, apparently we have to turn on the mic. We need assistance for that, so. All right. Can you hear better now? Okay. Good afternoon. I'm Terry White, and I'm the Commissioner for the Oklahoma Department of Mental Health and Substance Abuse Services. This is a really difficult day for our department and for the behavioral health network across the state of Oklahoma. And it is an especially difficult day for the families and individuals who rely on our life-saving services. None of us want what I'm getting ready to announce to happen. Absolutely none of us. None of the group standing behind me, none of the group down at the street at 23rd and Lincoln, none of the Oklahomans who rely on the services available to them today. But the reality is that we have lost $75 million when the cigarette fee was thrown out by the Oklahoma Supreme Court. Without additional appropriations for the 2018 current year budget, we have no choice but to begin talking about what the implementation of $75 million worth of cuts looks like. For the Department of Mental Health and Substance Abuse Services, we begin to run out of money December 1st. December 1st, we do not have enough money to pay all of our bills. We are $6 million short. By January 1st, we are $17 million short. By February 1st, we are $30 million short. It goes on from there. By June 1st, we are $75 million short of paying for the required services currently provided in the state of Oklahoma. I truly believe that the governor and the legislators of Oklahoma do not want to see $75 million of cuts implemented in the Department of Mental Health and Substance Abuse Services. There is time to avoid this, but the only way for that to happen is for an additional appropriation to take place. Beginning November 1st, we will have to announce and begin the processes of emergency rules and putting cuts into place so that they will go into place during the months of December and January unless we receive additional appropriations. For this to happen, to avoid these cuts, the individuals at 23rd and Lincoln of both parties must work together to find a compromise and an alternative solution that appropriates funds for mental health and substance abuse services. Our hope is that a solution is found. I believe there is still time. If there is a solution found before the first week in November, we do not even have to begin the process of implementing cuts. If we get to that point and there's not a solution, we will begin the process. If a solution is found before December, those cuts will not have to go into place. But the fact is, we are at a point where we have to have this discussion because November 1st is just around the corner. And if implementations begin to, and plans are announced without this conversation, without all of us looking at the Oklahomans who are going to be affected, the providers, the community, our partners, our sister agencies, and most of all, the Oklahomans who need these services, if we don't look them in the face and explain what is going to happen come November 1st without action, we're not being responsible. These cuts that I'm going to discuss in detail are unbearable. They will decimate the state's behavioral health system, and in particular our outpatient network across the state. It is a network made up primarily of private providers, private nonprofits that we contract with, as well as state-delivered services. Unfortunately, these are the only choices before us that will allow us to preserve services for the most acutely ill, mentally ill Oklahomans and addicted Oklahomans. Standing behind me today, and continuing to join, standing behind me today, are people representing a cross-section of many Oklahomans who will be impacted by these cuts. Several are going to speak to you today, but I would like to take a minute to recognize a few who are here in solidarity but will not be speaking formally. I'd like to first recognize one of the members of our board, Major General Retired Rita Aragon, who is here representing the servicemen and women across our state and the veterans who need these services. Dr. Marianne McCaffrey and Dr. Brent Bell, also members of our board, who are here representing physicians that are desperately trying to continue to save lives. Debbie Hampton, the president and CEO of the United Way of Central Oklahoma, and Mark Graham, the president and CEO of the Tulsa United Way, who are here because their agencies and the services that they try to provide are going to be affected. There are many others here today, many who represent the Department of Mental Health and Substance Abuse Services Governing Board, law enforcement, criminal justice and the court system, the business community, the hospital association, members of the medical community, and most of all, the mental health and substance abuse treatment providers and service recipients who are going to be affected and are the backbone of our system. To see this many people from so many different fields is a testament of how important the issue of brain health is to Oklahoma and how dire the announcement is that we are going to make. Very specifically, $75 million is 23% of the Department of Mental Health and Substance Abuse Services' overall annual budget. However, we have to, if legislative action doesn't occur, we have to remove that $75 million in the second half of the year. We only have 6 months instead of the full year to address those cuts. That basically takes the cut from 23% of our budget to 46% of our budget during that 6-month period. Half of our budget. Half of the services will have to be eliminated in the state of Oklahoma the second half of this year if action isn't taken. That leaves us a choice because there's basically 2 things the department does. We provide treatment either on an inpatient basis or an outpatient basis for Oklahomans struggling with mental illness and addiction. We save lives through these services. The way the system works, those who are the most acutely ill are who receive inpatient services. By the statute, you have to be at the point that you are a danger to yourself or someone else before you can access inpatient psychiatric care in our state. We cannot start by eliminating those services because we know that when people get the help they need, they can live a full and productive life. But when we take away mental health and substance abuse services, that's when we have to worry about the negative consequences. And if we eliminate the services that currently people are a danger to themselves or someone else in receiving them, we know those consequences are only going to happen much more quickly. Therefore, we're forced to start with outpatient. In order to achieve a $75 million cut in the last 6 months of the year, we will have to eliminate every outpatient service available in the state of Oklahoma, with the exception of medications. Once that happens, that still only yields us about $65 million in the second half of the year, which means we have to make an additional cut. At that point, we will be included in this, we will be eliminating what is called psychiatric residential treatment for children. It is not a service that's available in the adult system, but it is one step down from the most acute inpatient hospitalization for kids. That service will no longer be available in the state of Oklahoma. This means that what we will be able to provide, and part of the reason we're having this discussion today is that so people know there will still be some services available. The services that will be available are acute inpatient for adults and children, crisis care for adults and children, and medications in the community. Unfortunately, what that means is the elimination of all other outpatient services, which are the backbone of our system. The majority of Oklahomans, approximately 189,000 Oklahomans, receive services through this system every year. It includes the elimination of all outpatient programs, which means there are no treatment services for drug courts. There are no treatment services for mental health courts. There are no PACT programs. There are no systems of care programs, the program that serves our children with the most complex mental health and substance abuse needs on an outpatient basis. And the backbone is the basic outpatient services for the Oklahomans that are fighting these diseases and achieving recovery by accessing that care, but their program doesn't have a fancy name. It's outpatient services. And it's what keeps them from ending up in psychiatric crisis. It's what keeps them from ending up in a drug court or mental health court. It's what keeps them from ending up in an emergency room. It's what keeps them ending up from the back of a police car, the inside of a jail cell, or the inside of a prison cell. This will affect approximately 700 agencies across the state. Those agencies employ about 8,800 therapists, doctors, case managers, and nurses, not to mention the hundreds of support staff. This will mean all outpatient services. The vast majority are provided by our private contracted network, but it also includes the few places we have left that are operated by the state that deliver outpatient services. And we will have approximately 300 state employees that are laid off, RIF'd, or let go. We estimate in the private sector the number will be several thousand if this cut has to be implemented. The impact is going to be far beyond the individual. It's going to impact families and communities at every level. It means the loss of jobs, of state and private jobs, of local outpatient treatment, and it will have a grand impact, unfortunately, on our economies. We can keep from initiating this process in November if the legislature comes to an agreement, a compromise, and acts. Once we initiate the process, we can keep these cuts from going into place in December and January if the legislature comes to a compromise, an agreement, and acts, and in that vein, appropriates this money that is desperately needed by all of the providers and folks that you see behind me. Before I take questions and we take questions, there are several members of this group who would like to speak. First, I would like to introduce to you Joy Sloan, the Chief Executive Officer of Green Country Behavioral Health Services, headquartered in Muskogee, and Janet Cizak, Managing Partner and Chief Executive Officer at the Center for Therapeutic Interventions in Tulsa.